What if an unseen enemy was slowly taking over your body, one cell at a time? Welcome to the horrifying reality of cancer. This is a battle fought not on a battlefield, but within the very fabric of our bodies. An unseen enemy, cancer, wages war on our cells, corrupting them, turning them against us. Imagine a thriving city suddenly taken over by a malevolent force, causing chaos and destruction. That's what cancer does to our bodies, turning healthy cells into destructive ones. In the blink of an eye, life transforms from a serene river into a turbulent ocean. A diagnosis of cancer shatters the calm, casting long, menacing shadows of fear, uncertainty, and despair. This is not just a physical affliction. It's an emotional, psychological, and spiritual ordeal. It's a test of courage, resilience, and hope. And it's not just the person diagnosed with cancer who feels the impact. This insidious disease reverberates through entire families, disrupting lives and leaving behind a trail of heartbreak. It's like a stone thrown into a pond, the ripples expanding outward, touching everyone in their path. The conventional weapons in this war against cancer are chemotherapy and radiation. These treatments, while necessary, are akin to carpet bombing. They target not only the cancer cells but also the healthy ones, leaving the body ravaged and weakened. The side effects, nausea, fatigue, hair loss, are almost as terrifying as the disease itself. Yet despite the harshness of these treatments, they offer the glimmer of hope, the possibility of victory against this unseen enemy. But the journey is long, arduous, and fraught with uncertainty. The battle against cancer is not for the faint of heart. It requires courage, determination, and an unquenchable spirit. With the terror of conventional treatments, many seek alternative paths, but what options exist and are they effective? As we delve deeper into this topic, we'll explore these alternatives, looking at everything from herbal remedies to unconventional treatments, and assess their efficacy in the fight against cancer. Nature has always served as mankind's pharmacy. Could the answer to cancer lie in herbs like cat's claw and pau d'arco? For centuries we've learned from Mother Nature, using her bounty to treat a myriad of ailments. Today we're exploring two such gifts from nature's pharmacy, cat's claw and pau d'arco, and their potential role in the fight against cancer. First up, cat's claw. This woody vine, native to the Amazon rainforest, has been used traditionally for its immune-boosting properties. Contemporary studies have shown that it may indeed enhance the immune response, which is crucial during cancer treatment. But let's not rush to conclusions. While some studies have shown promise, others have cast doubt on the vine's effectiveness. What's clear is that more research is needed to fully comprehend the potential benefits and drawbacks of cat's claw. Next, we turn our attention to pau d'arco, a tree that thrives in South America's rainforests. Its bark, steeped in water to make a tea, has been used by indigenous communities to treat various ailments, including cancer. Some laboratory studies suggest that compounds found in pau d'arco may have anti-cancer properties. However, these are early days, and much remains to be understood. It's essential to remember that while these herbs may show potential, they are not a silver bullet. They are not a guaranteed cure for cancer. They might support overall health and wellness, perhaps even complementing conventional treatments. But they are not replacements for proven therapies. Also, it's worth noting that these herbs, like any substance, can have side effects. Cat's claw, for instance, may cause headaches, dizziness, or vomiting in some people, while pau d'arco can potentially interfere with blood clotting. Moreover, the quality and composition of these herbs can vary greatly depending on where and how they're sourced. This variability can affect their safety and effectiveness, adding another layer of complexity to their use. Finally, it's crucial to involve healthcare professionals in any decision related to cancer treatment. If you're considering using herbs like cat's claw or pau d'arco, it's vital to do so under the guidance of a knowledgeable practitioner. They can help manage potential interactions with other treatments and monitor for side effects. So, in the quest for cancer treatments, do herbs like cat's claw and pau d'arco offer hope? Perhaps. They offer potential, but also present challenges. They are part of the vast tapestry of natural substances that we are still exploring, still trying to understand. In conclusion, the journey to discover nature's full potential in the fight against cancer continues. It's a journey of hope, but also of caution. As we delve deeper into the world of herbal remedies, we must remain open to their potential, yet mindful of their limitations. Herbs may offer a natural approach, but they are not without their controversies and limitations. Joe Tippins turned heads when he claimed a dog dewormer, Pancour C, saved him from terminal cancer. But is this a miracle or just a medical anomaly? This is the question that has sparked a whirlwind of discussion, speculation, and of course, controversy. Let's delve into this unconventional solution. Joe Tippins, an Oklahoma man diagnosed with small cell lung cancer, turned to a canine dewormer after exhausting his options with traditional treatments. His story is nothing short of astounding. He claims that within a few months of starting the dewormer, his cancer was in remission. Now, years later, he continues to be cancer-free. His story has inspired others, some of whom also claim success with this unorthodox method. But what is Pancour C, the dewormer at the center of this story? It's a drug used to treat a variety of parasitic worm infections in dogs. Its active ingredient, fenbendazole, has been the subject of some scientific scrutiny. Some laboratory studies suggest it could inhibit the growth of cancer cells. But it's important to remember these are preliminary findings. They are a long way from being accepted as definitive proof of the drug's efficacy against cancer in humans. Now let's consider the potential benefits. The most obvious is the hope it offers to those who feel they've run out of options. If Tippins' story is anything to go by, the results can be remarkable. The drug is also relatively inexpensive and readily available, making it an accessible option for many. However, it's crucial to understand the drawbacks as well. Firstly, the lack of comprehensive clinical trials means we don't have definitive evidence of its effectiveness or safety in treating cancer. There are also potential side effects, including liver damage, hair loss, and immune system suppression. The medical community remains cautious. Many doctors warn against abandoning proven treatments in favor of untested alternatives. They stress that while hope is important in battling cancer, it should not lead to risky decisions. It's also worth noting that the FDA, the agency responsible for ensuring the safety and efficacy of drugs in the United States, has not approved fenbendazole for use in humans. This means its use for cancer treatment is considered off-label and is not regulated. So is dewormer a miracle cure for cancer? The jury is still out. While some may find hope and potentially even healing in this unconventional method, it's important to approach it with an open mind and a healthy dose of skepticism. Remember, everyone's body is different, and what works for one person may not work for another. It's vital to consult with your healthcare provider before making any decisions about your cancer treatment. The story of Joe Tippins is fascinating, but it's essential to remember that not every treatment works for everyone. As we continue to search for answers in the complex world of cancer treatment, it's crucial to keep an open mind, stay informed, and make decisions based on the best available evidence. Chemotherapy and radiation, while effective, come with their own set of terrors. But are these fears justified? Let's dive into the depths of these conventional treatment methods to understand them better. When we hear the word chemotherapy, it often conjures up images of debilitating nausea, hair loss, and fatigue. Indeed, these are some of the side effects that patients have to endure. However, it's important to remember that these side effects are a result of the medication aggressively attacking the cancer cells. The same goes for radiation therapy, which uses high-energy particles to eradicate cancer cells. Side effects such as skin changes, fatigue, and other organ-specific symptoms are a part of this process, but the terror of these treatments extends beyond the physical. The psychological impact of undergoing such intensive procedures can also be daunting. The anxiety of waiting for results, the fear of the unknown, the stress of managing side effects, all these can take a toll on a patient's mental well-being. It's also essential to note that these treatments are not without risks. There's the potential for long-term damage to the heart, lungs, kidneys, and other organs. There's also the risk of secondary cancers, which might develop years after the treatment. Now, this may sound terrifying indeed, but it's crucial to remember that these are potential risks and side effects, not guaranteed outcomes. The effectiveness of these treatments in fighting cancer and increasing survival rates cannot be ignored. Every patient, in consultation with their healthcare provider, must weigh these pros and cons. It's a balance of the potential for cure against the potential for harm. And this balance is different for each individual, depending on their overall health, the type of cancer, its stage, and many other factors. Conventional treatments, while terrifying, are often the most effective, but the search for alternatives continues. The goal is to find treatments that are not only effective but also less traumatic or even better preventive. Until then, the terror of conventional treatments is a reality we must acknowledge and navigate. The horrors of cancer and its treatments can leave one feeling lost and terrified, but hope lies in understanding and exploring all possible options. And that's exactly what we've done today. We started by acknowledging the unseen enemy, cancer, a foe that can strike anyone, anytime. It's a terrifying prospect, but the more we understand about it, the better we're able to fight it. Then we delved into the world of herbal remedies, exploring natural options like cat's claw and pau d'arco. These herbs have been used for centuries by indigenous communities, and some research suggests they may have potential in the fight against cancer. But remember, while these herbs may offer benefits, they are not a guaranteed cure and should not replace conventional treatments without professional guidance. We also looked at an unconventional solution: dewormers. The story of Joe Tippins and his use of Pancura C, a dog dewormer, to fight his cancer has sparked curiosity and hope. While his story is inspirational, it's important to remember that this is still an unproven treatment. Always consult with a healthcare professional before trying something new. Next, we confronted the terror of conventional treatments. Chemotherapy and radiation are often seen as necessary evils, their benefits overshadowed by their harsh side effects. Yet they remain some of the most effective tools we have in the fight against cancer. In all these discussions, one thing remains clear: there are no easy answers in the battle against cancer. Each person's journey is unique, and the best treatment option will depend on a variety of factors, including the type and stage of cancer, overall health, and personal beliefs. Remember, every journey is personal, and what works for one may not work for another. Stay informed, stay hopeful, and never stop fighting. Because in this fight, knowledge is power and hope is your greatest ally.